What I'm going to go and share with you is a journey from many people that have been on a path of suffering, sickness, and infertility to now taking care of their little ones and the journey that they went on. And so I really want to touch on why many women struggle with infertility. We'll touch on a little bit of the male factor fertility, but I want to show how do we look at it from the Wellness Way perspective as well, from the standpoint of, yes, hormones are important, but so is the immune system. And if you've never been taught this before, it's extremely important. So fertility, the first steps, I want to share my biggest why. Now, this is my family, my wife, Chantel, Marshall, and then Weston. This is really the reason why I share what I do, because before having children, I did not have a desire, necessarily a burning desire, to care for children or women that are struggling through fertility as much as I did after my firstborn Marshall. And it was because of the power of the human body that I saw and just the joy that comes from being a father. I was so focused on how do I help many families as I can also experience the joy of fatherhood, of motherhood, and especially negating some of the suffering that I know many of you guys have been through, years and years of trials, tribulations, trying to figure out the why behind all of this. And so this is what this video is for. This video is for you guys to see what kinds of things are possible in terms of your fertility journey, your infertility journey. The trying to conceive now becomes trying to test and find why your body does not feel necessarily safe enough to have a baby. So let's check it out. The birth rate is continuing to go down, and I think there's two factors of this. Yes, there's the economic factor where many people are choosing not to have children because there is a cost associated with that, but the birth rate in terms of how fertile we as humans are is actually decreasing. You look at the male factor where sperm, testosterone is tanking. You look at the female factor where we're seeing more endometriosis, more PCOS on the rise now. And so it equates to much of the decline that we're seeing. And it's something that too, as a human race, as people that are desiring to have the connectedness of family, if we continue to see this decline, it becomes not so much of a we're going to go extinct type of deal, right? But it's more of how are we as people connecting with one another, connecting as families, because then that decline creates less community, and with less community, we as humans don't thrive. We thrive better when we have a lot more community. So I love, first of all, fertility cases. I told you a little bit about my journey in the family, but for situations like this, I received this message probably about a year ago around this time, and this is one of my most favorite messages to get. We deal with a lot of other health issues within my clinic, both autoimmune condition, gut health issues, joint pain in general, but this by far is my favorite message to receive, because I know that now this couple or this family that has been struggling for so long like the experience of joy that comes for them is honestly unmatched. When people feel better, that is honestly something that I love to see. But when people feel so good that then it produces an environment that's safe enough for them to have a baby, and then now they're gonna know that their whole journey that they've been on is now at a point where it's like it's finally here, that joy is unmatched. So the reason I do this is for messages like this. So why focus on fertility? Well, honestly, I saw my wife, and this is why we started this clinic. My wife was struggling with migraines, fatigue. She was taking an inhaler because she was having such bad asthma flare-ups. She was taking a Benadryl at night just to breathe. And I saw her go from a woman like this. Now, she wasn't necessarily on a hospital bed, but she was dealing with chronic illness that did not make her feel good every single day. And what I really enjoy is seeing when women come into the office, and again, most of the time, especially if you're dealing with a trying to conceive or infertility journey, I like the couple to come. But when women come into my office, they're sick, they're suffering, their body does not feel normal, they do not feel like themselves. I enjoy taking them from a journey of sick and suffering to feeling like themselves, feeling so good that now they can produce another life. And so that's why I focus on fertility, is because that whole journey, it makes it so that honestly, it's fulfilling for me in my journey of life in terms of what I believe I was put on this earth to do, but also too in instilling a legacy for this family to now be like, hey, we have our babies, the babies that we've dreamt and prayed for so much. And so infertility, though, the prevalence is growing. We have so many women that are struggling not only to get pregnant, but also carry a pregnancy. And so this pregnancy loss factor or infertility loss is matched by these numbers that are here. And if you are somebody that is struggling with this, it's hard when you look at the increasing, like I said, the birth rate's decreasing, but also the increased rate of infertility and pregnancy loss. And I always want to try to focus in not so much on, hey, what is the success rate of everything that we go through? But what I look at is how can we make your body so healthy that it functions at a foundational level of what it was designed to do, which is for women to have a baby. So now testing is everything. Many women come into my office having had some form of testing, hormonal testing, but I do believe it's poorly executed. And you may have had something like this where these red check marks are, where you may have had some of those tests done. But I see this commonly is some of you ladies have gone and you've gotten hormone testing, and it's been at no fault of your own, more willy-nilly. It's been like, hey, yeah, go in and get your hormones tested whenever you want. And then you end up being more frustrated because you go in, get it whenever in your cycle, not at a specific time, and then your doctor says it's normal, even though if we looked at it at a different time of your cycle, it may have been completely different. So I always use the example of progesterone. I typically like most of the women that come into my clinic to get their progesterone tested around 6 days after they ovulate. Now that doesn't apply to everybody because there's different situations, whether your period is extremely long or whether it's super short, or maybe you have had no period at all. So the progesterone factor, if you get that tested, let's say day 10 before you even ovulated, it's going to be lower. So it's going to fit into a range that's a lot lower, more likely to look normal, versus if we tested it on 6 days after you ovulate, let's just say day 21, where I want it to be at its peak so that it can feed into a pregnancy. And if it's still low but in range, they view that as normal. But I'm looking at it from the standpoint of this woman is sick and suffering. And if that progesterone, it was 10 points higher, let's say, that fertility would be a lot more likely. I want to increase the odds. And if we're not testing progesterone at the right time, how are we supposed to know what our odds are? So right now, fertility treatment is kind of like, hey, good luck, let's give it a try for a year. If it doesn't happen in a year, then we kind of move into, have you tried this? Check this out, try this. And all the while, we have so many women going through things like chemical pregnancies, miscarriages. This is the biggest frustration I have. We put women and families through so much suffering. You try for a year, maybe you've gone through 1, 2, 3 miscarriages, and we act like it's nothing when it takes an emotional toll on that woman and the family and everybody around them. And this is I hate this for you guys because you want a successful pregnancy, but when your doctor says, hey, try for a year, and meanwhile you go through this whole process and maybe you have miscarriages, maybe that next month after month after month, when it's not happening, I don't get it. When we could test for certain things that make it that much more likely for somebody to get pregnant, and instead we put this through this year of emotional turmoil where it's just kind of a guessing game, or maybe they do go through miscarriages and what's said is we don't know why it happened, but meanwhile they have labs and other things that could have been done beforehand that may have shown why it would have happened. So I don't want it to just be this guessing game of try this, try that, all these kinds of things, and really get you to the target a lot sooner, a lot faster, instead of wasting time and going through that emotional pain. The cost is also a big factor. When you talk about IUI, IVF, and going to the point where you finally get that success, the cost of infertility treatment just continues to rise. And we've had women that come through that they've been through multiple rounds. So for what we do here, and everybody's case is different, but what I usually tell ladies is, look, if you desire IUI or IVF, that's entirely up to you. But what we are doing in my clinic at the very least is setting you up for more success. So if you are going to go spend $10, $20, $50,000 worth, that it's that much more likely for you to succeed versus spending the money, hoping for the best, and not getting any clear outcomes. So all that hurt, all the heartache for hopefully it leading to motherhood. I'm a big fan of hope. I am. But I don't want to bank an entire family on a hope. I want to try to increase the odds as much as we possibly can. I think there's a lot more that we can do. I think there's, from the women that have come through my clinic so far, there's a ton more we can do. So this is what I look at. I look at the immune system and your hormones, and I use those pieces of the puzzle to then bring together so that we can have more fertility success. And I'm going to break down why that's important, but most women come in, let's say they do have their hormones tested, which is still very incomplete a lot of times, but almost none, I would say maybe maximum 1%, have had anything to do with their testing of their immune system. And that is honestly where a large majority of our success lies, is looking at the immune system side of things, because if you can look at the immune system side of things, you can then know whether the body is in more fight or flight, is in more stress, or if it is at a place that's in rest, digest, fertility mode. So, what are some of the main causes of infertility, at least in my clinic? I see this, yes, with hormone issues, but I will tell you this, guys. Hormones are oftentimes secondary. Hormones are often secondary to another area of the body that is feeling under fire, under threat, that then does not make the body feel safe enough and has safe hormones, and instead it has fight or flight stress hormones, which, I mean, raise your hand if you're stressed, right? We think about the mental stress side of things. There's jobs, relationships, kids that maybe you already have. That stress is mental, but there's a lot more that goes into it from a physical standpoint, or let's say a toxic standpoint, that affects the immune system that then creates hormone problems. There's metabolic issues, which we see this time and time again with PCOS. A lot of you ladies that have been on PCOS are just told to take metformin, but there's other things that can be a big role of that. But the metabolic issues is a problem as well. Gut issues, immune system, and then there's anatomy issues. Now, a lot of the time when it comes to anatomy issues, we're not dealing with anything like that, but I am dealing with a lot of the things that are above that line. So, where do we start? Let's start with the steroid hormone pathway. This is what most women should be getting tested with their hormones. Now, if you look at this list and you're like, I've never had this, I've never had this, I've never had this, that is a great time to talk to your doctor who maybe had run your labs before, or find a new one, let's say, like what we do, and get the actual full picture of your hormones. So I want to break this down just a little bit real quick, because if you are in fight or flight, you are stressed, most people know about cortisol. You've probably heard this before with your fight or flight. Now with cortisol, this is a survival hormone. Your body's always going to prioritize cortisol to help you survive better. The consequence of that, though, is that especially if your body's under stress, it's going to prioritize cortisol and take away from things like progesterone, maybe take away from things like estrogen, testosterone, DHEA. And if it takes that away, now you have no hormone left to feed into maybe a normal hormonal balance, or maybe even the progesterone at the very least, to feed into a pregnancy. And that's why I believe that we do have a lot of the issues that we do today is in large part because of us not getting properly tested, and us not teaching women when their body's under stress, and if they're under stress, what do we do for it? This is why I honestly do like having most women getting tested every 3 to 4 months for some of these, because if you can get tested for them every 3 to 4 months, I mean, you think about it's in the dead of winter right now. 6 months ago, or 6 months until after now, you're probably going to feel completely different hormonally. So you might have different stressors of life. You might have different stressors on your body that then you need to support for. And so that's how I view this. This is a blueprint. This is a map of what you need to help build your body to be better supported through areas of stress. And we can test for this. This is cortisol. This is actually my wife's test. And her cortisol, guys, I don't know if you can see this on the screen, but normally there's a red line that's here. That's her value. Patient value is supposed to start in the middle of these two dots. It's supposed to raise up and then kind of peter out through the night. Hers was flatlined. There was none. And now most of you guys are like, wait a second, I thought high cortisol was the problem. I thought high cortisol was the issue that everybody deals with. Eventually, your high cortisol becomes so much that you have nothing left in the tank to give. your cortisol, and I'm going to talk about my wife's story, was so impacted for her because her cortisone level, which is something where most of you guys have probably heard of a cortisone shot, anti-inflammatory. Your body can actually make that on its own, not to replace a cortisone shot, but it can make it on its own. And if your system prefers it, which is what this kind of gas gauge looks like, her system completely preferred cortisone. And that's when I look at that and I'm saying, okay, it's not so much that her body is mentally stressed, but it is certainly physically stressed because it's trying to compensate for the cortisone, for the inflammation that her body is under, for the immune system stress that her body is under. And so I was looking at her values and I'm like, man, she has nothing left in the tank. Her cortisol was, especially before this lab, and this happens over time, guys, but spike after spike after spike after spike, especially in an irregular time, because a regular spike is supposed to be in the middle of the day. I don't even like calling it a spike because it's really just a regular pattern, a regular rhythm. But if you have an irregular pattern, an irregular rhythm, then that can be a complicating factor. So if you happen to be a night shift nurse, if you happen to be a night shift worker across the board, your cortisol pattern might be a little bit more dysregulated. And then you get levels like this, progesterone being at 1.09. Now remember, I like to test for about 6 days after you ovulate, and I'm going to show you what that looks like. But that mid-luteal phase, the low end of the range is 4.44. They're nowhere near that. So functionally, yeah, their hormones are going to be imbalanced. This is what I mean when I talk about hormones being imbalanced, because yes, your hormones fluctuate on a day-to-day basis, but where we know the hormone should be at a mid-luteal phase is not, then that is an out of balance hormone. It is not at a place where it should be, nor is it in function to relation to the other hormones too. So progesterone, 1.09, way too low, not going to be conducive or more successful playing the odds towards a pregnancy. And this is really what your hormones should look like. If a doctor has never showed you this, and I'm speaking more to you ladies that, like most women, let's just say you're starting your period around age 13. Has a doc ever gone through this with you? And if your doctor hasn't, maybe you've done it in like health class at some point in high school, but I mean, honestly, who remembers that? And many of you ladies at 13 get put on birth control because your cycles are so horrible, or maybe you're having hormonal acne, that BCPs are just the answer. And if somebody has not gone through this with you, I think this is extremely important, because then it helps you have more knowledge on where your body should be. So if you do get labs, you can understand your hormones better. And I know it sounds weird coming from a guy, but I look at my wife's story and I'm like, man, I wish, because I've been to doctor's appointments with her. It's like, I wish just her doctor would teach her about where her cycle should be. I wish that a doctor along her path, her health history, would have showed her what her body should feel like. But they never did. And many of you might resonate with that. Now, if a doctor has walked you through this, amen, that's awesome. I'm glad that they have. But here's what I typically look at. Like I said, there's day 14, let's say you're ovulating. That progesterone, which is this green pattern right here, should be rising and being at its highest mark around that day 21. If it is not at its highest mark, like that 1.9 value, guys, that's low. That's over here. We should not be at the level of a beginning of our cycle when we are on day 21. That should be at its highest. And we'll talk about estrogen here in a little bit, but that's at the very least what I look at is, okay, 6 days after you ovulate, progesterone being at the highest, we shouldn't have our estrogen super peaked and our progesterone super low. That can become more of a factor for endometriosis. Now, if we go back or to this one, here's something else I look into. Your immune system. Like I said, your immune system matters a ton. That's something that it does not get a lot of credit. It does not get talked about enough. And I'm not talking about taking something just to boost your immune system. I'm talking about what is physically draining your immune system. You can take all the boosters in the world, all the immune system boosting herbs and supplements and everything like that, but if you never figure out what is draining your immune system in the first place, what is stressing your immune system out, then I don't believe that those boosting things are as valuable as they could be. And I don't even like the word boosting the immune system, because really it's supporting a normal function of the immune system, which should be our goal. So these thyroid peroxidase antibodies. Now we have a panel that's called Thyroid with Hormones panel. These are all the thyroid markers that we take a look at. And more specifically, when women come into my office, I notice that many of them, aside from the progesterone factor, many of them have never had their thyroid antibodies tested. And especially if you are on an infertility journey, that's a big one to miss. Because Hashimoto's and its impact on thyroid, or on its impact on infertility, is huge. So I always look at it from the standpoint of this. And if you want to read this article, you can. It's down here. Hopefully you can see it. If Hashimoto's thyroiditis is not well controlled, it can negatively impact reproductive capacity, leading to infertility. And yet, I maybe have had one woman, I'll give you five out of the countless women that have come through with an infertility journey having had these tested. And if they do come in, maybe they tested for one, but not both, and maybe not even a full thyroid function panel in terms of where you're checking out TSH, how it goes with the active form of T3. Here's something else I'm going to point out too, because this is not often tested for, but this reverse T3 at the top, okay? Many women come in, and most fit in an okay category in terms of being at a decent level, but this reverse T3 competes for the binding site of your T3, which is the active form that your body uses. And the most of the time when I see that reverse T3 high, there's two scenarios that can make that. Number one is a scenario where there's malnutrition, or maybe a history of malnutrition where you're not getting the nutrients you need. And that can come from gut issues, that can come from issues like anorexia or bulimia, because that is common as well. Maybe not common, but that can be a factor. But the reverse T3 can also be seen in components like abuse, sexual abuse, physical abuse. If that is a part of your history, and anytime I see this, I always ask the ladies that when I see this, because that's also another factor of mental stress. That's also a factor of physical stress, that now the body does not feel safe. It's not getting the nutrients. It's not getting the active form of T3, and that can complicate things as well. But going back to, so that's something to take into account. But going back to the thyroid antibodies. This is due to the disruption of thyroid hormones, which can affect the ovulation and disrupt the menstrual cycle. However, it's not a consequence that occurs in all cases, which is true. I do not see that every single time, but it is something that, again, if I'm playing the odds to get somebody pregnant, I don't want there to be any type of factor that I haven't accounted for. Okay, because it can reduce the potential complications of infertility when you are getting effectively taken care of. Regarding how Hashimoto's thyroiditis can affect a male fertility, it can result in erectile dysfunction and low sperm count. So, guys, if you have not been tested for these thyroid antibodies, which is going to potentially make it so that you are not having success in your fertility journey, and this is for males and females, why is this not common testing when we know how much it can impact? We just sweep it under the rug, and yet women families go in and they pay $50,000 for a fertility treatment that doesn't even test for, in my opinion, one of the most basic things that could affect a pregnancy. Why do we do this? Why do we cause so much emotional turmoil? Okay, going back to the first point, we cause so much emotional turmoil by telling a couple to wait a year before they get testing. In that time, maybe there's no success, maybe there's miscarriages, and in that time, that whole year that they haven't gotten pregnant or they've had pregnancy losses, we never test them, and then we say, oh, you need to get IVF, and then they go and they spend countless of thousands of dollars without ever testing this component that might not even make it successful in the first place when they do implant those. All I can think of is the babies. You're not implanting a baby, but you know what I mean. That is why I am so big on fertility. I think we're missing a lot. This is also my wife's test, and this is going back to, I'm honing in on the immune system because, remember, hormones are secondary. When we tested her, she was allergic to soy, corn, cow's milk, peanuts, wheat. She only knew about the peanuts. And meanwhile, she's taking a Benadryl a night just to breathe, constantly having to take her inhaler, feeling crummy, not having proper bowel movements, constant migraines, constant headaches, having horrible cycles. This is another form of stress. This is another form that most people are not tested for, and I'm not saying that every single person is going to have this, but if your immune system is consistently stressed by something you eat, something that is more controllable than the mental stress side of things, this needs to be taken into account too. And for her, I don't even want to know what would happen if she was pregnant before knowing these, because then she's going to take a food in that's going to cause stress on her body. And what does stress do on a woman's body? It makes it not likely to carry a pregnancy. And then maybe we would have ended up with miscarriages. And that's the pain that I know a lot of you go through. And I don't want that for you. I don't want the pain of miscarriage because you haven't had the proper labs done. I want you to know, and like I said before, let's increase the odds, let's count for the variables, let's do what I feel like we should be doing to be taking care of the human body to, really it's this simple, going from a fight or flight, a stressed out standpoint, which again is not all in your head. There's physical components, there's toxic components, there's immune system components. That stress that the body is under, taking it from the fight or flight into rest and digest, making it more likely to be fertile, because that is what we are designed to do. We are designed to have proper pregnancies, not pregnancy loss day after day, time and time again, like countless of you women have had so often in your journey. And I'm getting a little heated on this because, again, if we go back to a year's worth of time where you're hoping and you're praying and you're waiting for that baby to come because you're trying, but you've never had your labs tested, your body becomes more stressed because you're like, wow, it's month 7 and this hasn't happened. I'm concerned. And your doctor's not willing to run any labs. I think that is a huge disservice when we could have known about this way beforehand. We could have known about this way beforehand. We could have known about these things before a woman, before they try. So the immune system can get impacted by the foods that you eat. In my wife's case, that was a huge stressor for her. Now this is another female that came into my office, again, trying for years on end. IUI. IVF, all the while having gut issues through her entire life that nobody has ever addressed. And what do we find? We have bacterial overgrowth, we have yeast overgrowth, and these issues, what do they do, guys? Yes, they affect the gut, but what else do they do? They affect the immune system. The immune system is constantly going to be on high alert. If you have a bacterial overgrowth, if you have a yeast overgrowth, and your immune system is on high alert, do you think it's going to be like, yeah, it's okay, have a baby? No. It's not going to feel safe. It's not going to feel like, yes, we are primed and ready for fertility. And so with this woman, she's gone through countless treatments already, and we're addressing her gut issues. And I kid you not, guys, pregnant 2 months later. What if she didn't go through all that pain? And I'm not even saying it's just from what we did, but I'm saying that is a heck of a timeline to be going through all of that time and to never see any success until we figure this part out. So yeast overgrowth, candida. And you'll notice, actually, real quick, it's not just candida. There's candida here, but there's also rotatorula species. There's other species of yeast that can affect things, but candida may be linked to endometriosis, and this may be because it alters the balance of microorganisms of the body and can cause inflammation. Guys, here's something to know about inflammation, is it's really just a stress on the immune system. That's all it is. There's something stressing the immune system out, so the body feels like it has to, well, not feels like it, it perceives it as a threat, and it has to take care of it. And if candida is present and your endometriosis is linked to that, how many of you women have ever been told that? And again, you can look this up. Medical News Today. Endometriosis is a condition that tissues similar to the lining of the uterus, the endometrium, to grow outside of the uterus. Candida is a yeast that naturally occurs in the body and only causes problems if it overgrows, which can lead to fungal infections. This article looks at the potential link between candida and endometriosis, what the research says, and tips to preventing candida overgrowth. And yet I have tons of women come in with endometriosis that have never been asked about this, never been asked about their gut problems. If you've never been asked about your gut issues and yet you're having a hormone issue, I always tell every single person and the females that come in, you cannot have good hormones with bad gut health. Good gut health produces good hormone health, okay? So if candida, and I want to touch on this real quick because I've had so many people say you can't have candida unless your immune system's suppressed. That is not true. And I actually want to go back to the first point I made, is that many people are not told how to support their immune system effectively. So your immune system is not robust. Maybe you don't have a full immunosuppressive diagnosis or condition, but is your immune system actually strong? Why else would this woman have candida in her gut? She didn't have any of that. She's been tested countless of times. I get frustrated, guys, because I hear all these things. I hear you women get gaslighted, and you've never ever been told these things. And it's wild to me how you go into your doctors, you tell them you feel off, you don't feel like yourself, you go in and you get the most basic hormone testing done. They never look deeper. They're never relentless about your health. And if no doctor is relentless about your health, what are you left to do? I want to let you guys know that there are other things that you can do. You can get better testing. That is what the Wellness Way's mission is to get you better testing, to find out more about what's going on across the board for your full health. To get the body well again, you have to take it out of a fight or flight. And if you don't feel like yourself, that means you're in fight or flight. And if nobody points out what the trigger is, what the cause is, why is this happening, and not just gaslighting you to thinking that it's all in your head, then there is a problem. Not with you, but with them. Something else that I also look at is the immune system importance when it comes to mold. And I've seen this in a few cases of my fertility patients. This is a mold test that we do. I don't always suggest it to every patient that comes in, but I do suggest it to women that maybe have been exposed to mold either when they were a kid or currently, because a lot of you guys are in apartments, school systems, homes that have mold. And I want to highlight this citrulline, okay? Citrulline can inhibit protein synthesis, preventing the formation, initiation, and complex necessary for protein synthesis. Citrulline damages DNA by forming adducts, and these can lead to mutations, increasing risk of cancer. That's one thing to know. But citrulline can induce oxidative stress by generating reactive oxygen species, induces inflammation by activating macrophages, and in humans, citrulline has been linked to infertility, reduced sperm count, and increased rates of miscarriages. How many of your doctors have at least posed the question, are you in an environment of mold, or dug deeper to figure out if mold was a part of your past? Because, and this goes for guys too, because if it's reducing sperm count, let's say both of you guys are reducing sperm count and both of you guys have a portion of your health that now is not cohesive, that now there's nothing you've done wrong, but your health needs support. It needs to get rid of this stuff, and it needs to be able to feel safe again to have a baby instead of having inflammation in the reactive oxygen species and mutations. And I actually think this too, guys. I'm gonna touch on this real quick. I think the mutations is actually something that can lead to more miscarriages. Because if you are developing a baby in your uterus, those miscarriages, that the genes that are forming for that baby, your body's going to check off each gene snip that comes through. It's going to be yep. Oh, wait a second. That mutation doesn't look right. That might terminate the pregnancy. But how many of you are asked about mold? So we need a plan. Here's my plan, plain and simple. If your body's under stress, we have to figure out why. And I know what you might be thinking, but I want you to go back to the beginning. Remember, stress is not just the mental side of things, it is physical. It is going into the body and seeing, okay, is there mental stress? Yes, check. Is there physical stress? Maybe you're in pain. Is there toxic stress? Maybe your immune system is under attack and is under a threat and it doesn't know what to do. And so if I look at it from that standpoint, the plan now becomes, how do I protect this person's body? How do I protect this person to get them out of this fight or flight mode, this area of stress, and into rest and digest and fertility? Because now their body's able to feel safe enough to have a baby, or maybe from a male factor, now their body feels safe enough to actually produce a proper sperm count, produce enough testosterone to then make the variables a lot less likely in an infertility journey or trying to conceive. So the plan, in my perspective, always comes back to those two things, the immune system and the hormones. If you can make your plan, whether you're working with me or not, focused on these, I see a lot more fertility success. I see a lot more women with a lot more joy in understanding why they maybe did not feel themselves, or why it felt so hard to get a pregnancy going, or why that pregnancy loss happened when we're able to checkmark these two. Now, these are not the only things. It does not guarantee success, but like I said, I want to play the odds. I want to help the variability. I want less variables that are going to keep you from having a baby. I want more women to go from not feeling like themselves to thriving so much that now they have children of their own, that now they go through life feeling themselves, feeling the joy of family, and also too, not having to have that stress that they were dealing with before in terms of waiting a whole year, spending countless of thousands of dollars with no success, having more stress month after month after month. So I want everybody that comes into my clinic, but especially females, to go from maybe you're not feeling like yourself, and now we get you to a place where you're thriving. And now if you're thriving so much that you can have children, that now your body actually feels safe, it feels comfortable, you feel like yourself, and you reap the benefit of having children. So that we can have more messages like this. So that we can have more humans connected, so that we can have more people connected and loving what their life is producing, not sad, hurt, sick, and chronic illness, and having this pain cycle that we consistently go through. And I see this time and time again with families that are struggling, not because somebody did something wrong, but because they're sick and they need help. And that's what we want to do at The Wellness Way. Guys, if you need some help, click the link in the bio or message us. Our email is grandrapids@thewellnessway.com. Give us a call, 616-734-6498 if you need some help. See you guys later.